This is a training workshop for patient care to improve staff performance here at Brownsville Memorial Hospital to lower risk and increase patient protection. These are the concerns to address. Communicating clearly. Know what you want to say to the patient and practice how this information will be presented. Encouraging patients to ask questions. By asking patients questions, it gives a clearer picture as to their understanding and what needs improvement or clarification. There are other concerns such as educational materials. However, addressing these 2 points will address all of the concerns as these are key in all communication. Importance of health literacy. People are more likely to follow treatment and ask their health care providers for help if they understand what the treatment is for and if they feel confident in their health care team. Making sure that patients are comfortable will ensure a better atmosphere for learning as well as for seeking help. It will reduce anxiety and boost trust. Communicating in plain language is the best way to communicate without confusing patients or complicating the issues. Most Americans read and write at a 5th to 8th grade level, so it is important to speak to everyone as if they may have reading difficulty. Assume that everyone needs extra assistance. If they don't, they will still be appreciative of your approach. The importance of addressing concerns. It is important to communicate in a way that all patients will understand and want to comply with their treatment. Keep communication simple. Do not overwhelm the patient. Patients must feel heard and understood in order to comply with treatment and ask questions when needed. Frequently asking questions such as if they have concerns and then addressing those concerns shows you're listening and that you care. Patients must be made to feel comfortable to come to their healthcare provider with medical issues. Medication concerns and side effects. If they ask questions, do not judge. Side effects are serious and patient should understand what may happen and what they should look for. Patients should receive instructions in their preferred language. Understanding treatment instructions is key to compliance. This should be established first to ensure all information is understood and well received. Be patient and clear with all patients. It takes time to accept some diagnoses. Do not get frustrated and do not rush them or your explanation. Be courteous and lenient about time. If the patient needs more time, schedule another follow-up appointment to address all other concerns if the questions can wait, or provide resources for further assistance such as social worker. Know your patients. You must have a general knowledge of your patients such as their gender, age, culture, and language. Who are they? You should know your community, what their beliefs are, and how to communicate effectively. Use humor when appropriate. Not all situations can be handled with humor. Humor can be used to ease tension, however, such as the sign here, where it says warning, patient will be charged extra for annoying the doctor with self-diagnosis, gotten off the internet. See how they receive this information. If they laugh with you, it may be okay to use humor. If they are very quiet, you can also state, "Wow, you are very talkative," just to see if they'll be more willing to answer. Gauge if there is understanding. Be observant of the person, their body language, how they're perceiving this information. Do they look confused? It can show on their face as well as their gestures. Do not use medical jargon. Use simple terms. Not everyone understands medical terminology, like using myocardial infarction is not always understood, but heart attack is more commonly used, such as for warning in medication. If you stop medication, it may lead to a heart attack. Repeat and request feedback. If needed, repeat the information. Use different wording if necessary. If you notice that the patient is not understanding, use different approach or different wording. Visual aids may be helpful here. Ask the patient to give their understanding of information. Have them repeat back or teach back what they have understood, what you have told them. Use medical interpreters whenever necessary. If you cannot communicate effectively due to language barriers, always use interpreters to assist. Be sensitive to culture. Also be aware of body language. Depending on the patient's culture, there may be remedies they use or beliefs in certain things which may be helpful or harmful when on certain medications. Discuss alternative remedies while being respectful and understanding of their practices and beliefs. Observe body language, as it can speak volumes on the person's comfort with you and the information that they are receiving. Overview of an exercise. Using clear language, go through a list of words to use, simpler language to use. Write 2 sentences which describe your goal with each patient. Describe how you would want to be talked to and how you wish to be addressed. These are areas of concern. Change the language used with patients. Just keep it simple. Understanding how people wish to be addressed and the information they want. In other words, be mindful of how you are talking to people. How would you like it? Watch your tone as well. Being empathetic to others and their views. Cultural sensitivity. Think of what you hold to be valuable and important. What is culturally significant to you? Would you want someone changing your practices or telling you that you're wrong? Gauging patients' challenges and being receptive or observant of the issues. Can the person read or write? Are they nervous? Do they have a support group? Again, listen and be observant. Try to help whenever possible and give suggestions. Here are some materials to be used. Videos of patients and their worries to be viewed. Watching scenarios and viewing some challenges may help you to understand what patients may go through and how to address these issues. Of course, use a pen and paper to write down how you wish to be addressed. Take notes. Jot down questions to be asked of patients, how they may understand, if they understand, and how you can help. Use a list of words or simpler terms to be remembered when talking to patients. You can also use scripts for information in diagnoses and treatment. Know what you will say and what you want to tell your patient in simpler terms. List of questions to ask to gauge patient's understanding or patient worries. Have some questions ready for your patients to ensure their understanding. And visual aids. Some pictures may be helpful in patients' understanding or to remember instructions, such as a sun or a moon, to instruct a patient to take their medication during the day or at night, and using certain colors. So you may use a blue sun or a yellow moon to help them remember the color of the pill that they need to take and the time. Here are some group activities. Role-playing will allow you to understand your patients and the difficulties that they face. Listening is also part of good communication. Listen carefully to what your partner states back to you in this exercise. Practice prompting with your patient. What did you understand? How will you take your medications? Are you having difficulty with this? How can we improve our technique? Feedback is very important, as that will help you to improve what it is that you're saying and how you wish to convey it. All feedback should be reviewed and discussed to ensure the most effective ways of communication, and this will also be done with the instructor to help you. Practice empathy. By being empathetic, you place yourself in others' shoes, and sometimes that is a very vulnerable place to be and can be scary. Be mindful of the fact that you can all be in that same situation or position at one point in your life, and you would want to be comforted. Good practices. It is good practice to listen. Sometimes listening is all one needs. It allows one to understand the needs of others and then take appropriate action. Discuss understanding with patient, ask questions, and have patient ask questions. Always keep it simple. Be creative when possible, but be sensitive to patients. Again, such as using humor when appropriate. Use visuals if reading is difficult. Using colors and pictures and videos to convey instructions for treatment to patients will be helpful. Ask and help establish a support group. Who will help them? Is a social worker necessary? Go over treatment and resources. Who can help for discounted medications if needed, or charity care, as well as dosage and possible side effects to look for. Always ask the patient if they need help. And here is a list of references for the information given. Thank you.